So thank you, everybody, for joining us for today's congressional briefing. We're going to be talking about COVID and the disproportionate effect on the Black community. So we thank you for coming out on this June 19th, this Juneteenth holiday. We're going to go ahead and first I'm going to give some just kind of housekeeping reminders before we really get started. I do want to let you all know that the event is being recorded, both on the WebEx and the Zoom link. We are going to have transcripts that will be posted shortly after the session. We're going to be posting that on the Partnership for Inclusive Disaster Strategies website. That's disasterstrategies.org, so you can find that transcript there. We also do have CART running for this call. It's directly in an attached Zoom room. That transcript will be at the Stream Text website. That's going to be in the chat shortly if it's not there already. So if you need the CART or would like to access that Stream Text transcript, both that Zoom and that Stream Text link will be in the chat. We do ask, as I mentioned a little bit earlier, that you turn off all your video settings except the ASL interpreter, and the presenters and speakers will be pinned. And we are going to have everybody placed on mute until we have until the Q&A. If you need any assistance throughout this or you're having any problems, please email us. We have somebody handling our email, and that's info@disasterstrategies.org. I'm not sure how that mute happened. Can you all hear me now? Okay, great. Sorry about that. I'm not sure how it clicked there, but we just want to go ahead and, like I said, thank Senator Casey and Representative Langevin, as well as so many of the community supports that have been on the ground during what has been a really long, I think, 2020 for a lot of us. And so we really wanted to do this panel today to sort of honor Juneteenth. And for those of you, I know we're not in a room, so I can't do a show of hands. I think a lot of us in school, we learned about the Emancipation Proclamation that was ordered in 1863, but many people are not aware that up until 2.5 years after that, until June 19th of 1865, there were still enslaved Black people within our country. And it wasn't actually until military force went into Texas that on June 19th in 1865, the last enslaved people were freed. And we know from our US history that that wasn't really the end of the conversation, right? Even though enslaved people were freed at that time, we then went on to see bombings of Black cultural centers and neighborhoods, histories of redlining and medical discrimination, educational discrimination, banking discrimination, job discrimination, Jim Crow laws, right? So we had a long history that led us to where we are today, which is seeing the compact and the compounding effect of multiple public health crises happening at the same time. We are going through a global pandemic, which we are seeing in the US disproportionately affecting Black and disabled people. And at the same time, looking at the very real public safety crisis of police brutality, primarily against Black people, but against people of color in general. And so today we're going to talk a little bit, we have an amazing panel that's going to talk a little bit about how these intersections are coming into play as we're in hurricane season. We know right now there's a huge fire happening in Arizona while we're living through this global pandemic and this public health crisis. And so today we have an amazing panel, mix of people, and I'm going to do some quick introductions, and then we're going to give them some time to speak. So today we are joined with, first I want to introduce Tyree Brown, who is a Black young woman who is a visual artist living in Maryland. She was in an accident in 2015 that left her unable to walk or use her right hand, which was her dominant hand for her art. She was 20 years old, living in a nursing home. A lot of times we think that these nursing home communities are only full of older adults, but is now back living in her community thanks to her faith and through some programs like Money Follows the Person that she's going to talk a little bit about today. We're also joined by Dr. Angel L. Miles, who is a healthcare and home and community-based services policy analyst with Access Living in Chicago. She has her doctorate from the University of Maryland in College Park in Women's Studies and currently focuses on monitoring disability rights in healthcare and home and community-based services, which, as they're going to talk about, is a huge part of what's going on and with the deaths that we're seeing through the COVID pandemic. We're also joined by Justice Shorter, who is the Disaster Protection Advisor for the National Disability Rights Network, and formerly was a Disability Integration Advisor with FEMA. She's authored 3 inclusion guides for the U.S. State Department, worked on lived experience and person-centered projects with organizations like the Hunger Project, and has an MA in Sustainable Development and International Policy. And so Justice is going to talk to us a little bit about the more policy side of both the COVID pandemic and the public health crisis or the public safety crisis of police brutality. Justice was also partnered very recently, having led a protest in March for Black, trans, and disabled lives here in DC. And we're joined lastly by Anita Cameron, who is the Director of Minority Outreach for Not Dead Yet. If you've been around any amount of time here in kind of the disability community, you've probably ran into Anita. Anita is a certified disabled person, was the first visually impaired CERT instructor in Colorado, helped create the first CERT class consisting of people with disabilities in New York, is a very, very well-known ADAPT activist in our community. And so we'll be speaking again on the intersections here. So we're going to go ahead and get started. We're going to open this up with Justice Shorter, who I think is calling in from the phone.
Life and freedom in this country. So we are extremely excited to have all of you here. I just want to ask people to give me a little bit of grace. I am listening to my computer. I am blind, and so there may be some momentary gaps during my small remarks here today, so please just be patient with me. I also live next to a fire station, which is quite fitting since I work on disaster issues, but you may hear some sirens. I'll do my best to shield you from the sound, but I did not want to do this presentation from my closet. As a lesbian, I've come out of the closet and I don't want to go back in. So I wanted to do it from my table where I could be a little bit more comfortable and set up. So I just wanted to remind folks of that as I start. So as I mentioned before, I want to focus on freedom. And when I think about freedom, I think about a freedom that is embedded in equitable and efficient access to healthcare, testing, and treatment for Black people who make up around 13% of America's population, and yet we account for around 21% of coronavirus cases in this country. And that's according to kind of the recent statistics that have come out from the CDC. When I think about freedom, I hope that we can all one day savor a freedom that tastes like clean drinking water, the absence of which is a human-caused disaster that remains a critical issue in Flint, Michigan, and in other communities of color across the country. I envision a universal understanding of the physical and emotional freedom that can be gained from accessible and affordable housing, the ability to live in the community in areas where housing is available outside of floodplains and that are built with durable materials that are more likely to withstand severe winds and storm surges. I think about freedom in a way that truly prioritizes power for those of us who are electricity dependent, especially during hurricanes and wildfires, when electricity grids are more likely to be damaged or when services are likely to be disrupted. I think about an intersectional freedom that first can be extended and past the 35-year life expectancy for Black trans women, but also a freedom that provides transgender and non-binary folks with equitable access to bathrooms and shelters and services and resources and supports before, during, and after disasters of all kinds. But we can't talk about Juneteenth without referencing the 13th Amendment, which constitutionally solidified the abolishment of slavery, except as a punishment for crime, whereof the party was duly convicted. When you have a policing system that was born out of slave patrols, there is no wonder as to why we as Black people are still being hunted, surveilled, overly convicted, and killed. Hatred is hazardous. Discrimination is disastrous, and police brutality is an ongoing crisis in this country. Like myself, many are starting to understand police brutality, the problem of police brutality, through the prism of the emergency management continuum. So that includes aspects such as prevention and preparedness, response and relief, recovery and resilience, all hazards mitigation. And in doing so, we're understanding this in a way that kind of brings forth this emergence of new creative conversations that are fostering new ideas such as, brutality prevention plans and community response and peer support teams, respite centers and pop-up shops where mental health workers are provided and water and snacks are provided to protesters. Folks are trying to understand how can we examine police brutality through more multi-agency coordination as a means of mitigating future risk of Black people being killed by the police. And how can each governmental agency be activated to provide more holistic support rather than this kind of militarized show of force, which only further harms communities that are already reeling from the impact of this crisis. Folks are trying to reimagine our public education system in ways that teaches racial and disability justice through curriculums and content that has been created by Black, Indigenous people of color, both with and without disabilities. And folks are also trying to make sure that these individuals who have created the content are properly compensated and included in any measures to kind of infuse those ideals and those theories and those frames and those thoughts into our public education system. And that's a beautiful thing. So as we look at these concurrent disasters, I've mentioned many things here. I've mentioned it in terms of wildfires and hurricanes and access to water, and looking at this in terms of housing, in terms of access to services and support. And that's kind of the kind of more granular view that we wanted to start off with. And I'll hold for a bit on getting down into the weeds in terms of the more institutional approaches, because I know my sister, Dr. Miles, will hit on that a bit more. But as we spoke a little bit earlier about the carceral system, it's important to note that according to the Marshall Project, over 46,000 inmates and prisoners and people in jails and prisons across this country have been infected with the coronavirus as well. So we're dealing with multiple things hitting us at once. To the extent that people are trying to find ways to not only fight for justice, but to also prioritize our joy. So as we try and strive to celebrate today, we want to do that in a way that realistically reviews all of the different aspects that are literally killing us, but also all of the different ways that we will reclaim our space and that we will reclaim our joy and our capacity to move forward in this country. So all of these things, all of these approaches, and so many more signals to me that hope is still on the horizon, and that sincerely gives me joy. I'll close out by simply saying a quote here from Erica Alexander, and she's an actress who commonly says this, and I absolutely love it. She says that the past is painful, the present is precarious, but the future will be free. And that is not a question. It is a declarative statement. And so I hope that all of you will join us on our continued journey toward collective liberation in this country. That's all from me. Thanks so much. Valerie, back over to you.
Thank you so much, Justice. I think that is exactly a way to start off this panel today is when we're talking about Juneteenth, and especially when we're in the U.S. I think we hold a lot to this idea that we are free. And I think it is really important to remember that, especially when we're here and we have a lot of people on this call that are part of the disability community. And we commonly exclaim when we talk about our family and friends and siblings that are in institutions and nursing homes, that also equals places like prisons, right? This incarceration that is antithetical to that idea of freedom we have. And so next we have Dr. Miles, who's going to talk a little bit more about how this divide exists between primarily Black, but Black, Indigenous, people of color communities and white communities. Dr. Miles?
Awesome. Good morning, everyone. Thank so much for having me, and thank you, Justice, for kicking us off. Like was mentioned, my name is Dr. Miles, Dr. Angel Miles. My pronouns are she, her, and hers. I'm wearing a light blue shirt with glasses and locks, short hair locks, and I'm an African American woman with spina bifida. So there's a lot. I only have 5 minutes, and there's so much to say about this topic. One thing that I want to highlight is, we're talking about Juneteenth, and just like African Americans who were told that they were free long after emancipation was actually proclaimed, didn't find out until years after they were actually emancipated. African Americans with disabilities have still yet fully benefited from the promises of Americans with Disabilities Act and the promises of disability policy over 30 years since the American Disabilities Act has been passed. African Americans tend to benefit less from disability policy, even though we have one of the highest rates of disability, second only to Native Americans, who have the highest. And the reasons why we have higher rates of disabilities are directly related to social inequalities that can be prevented. They're directly related to man-made issues, and they're directly related to legacies of slavery and of Jim Crow. And so African Americans have higher rates of poverty, are more likely to work in dangerous jobs, are more likely to be uninsured or underinsured. And these are just some of the things that make it difficult for African Americans to prevent the onset of a disability or rehabilitate a disability once it is acquired. And so because of that, we tend to have higher rates of disability, significantly higher rates of disability and of severe disability than the white majority. Despite having higher rates and higher need, we tend to receive less services, in part because of those same reasons. In addition, the service providers that we have are more likely to not be a part of our culture. So we're more likely to receive vocational rehabilitation, special education services, healthcare from white Americans who often have biases, whether overt or covert, some that they're aware of, and some are just like implicit biases that affect our access to care. And so we see these very same comorbidities that are making us have higher rates of disability are also making us vulnerable to COVID-19, to the Black community, COVID-19. We have, access to testing. So then we find out that we have COVID-19 later and test further. There's also biases in medical care, where there's been studies that show that doctors who are white are less likely to believe our symptoms, believe our pain. And so just as though, we're more familiar with time biases and the policing that lead to the death and incarceration of Black and brown people, there also is that lead to death and mistreatment of Black people with and without disability. Another reason why we're experiencing high rates of COVID-19 in the Black communities in jobs where we are essential workers, where we are frontline workers, and so there are lots of other employment people can social isolate. We're still going to work if they're work hours is the same as it was before for shut down, because we're in the grocery store and we're driving the buses and we're doing work in the nursing homes, and so Americans also be workers, places like nursing homes, and also to our to be at home are underfunded and are poor quality, and so we less hope. And so all these issues are community and disability really, and so these are decisions, social practice, and not or holder that are
Dr. Miles, this is Valerie. We are losing you, and I'm seeing some comments. So I'm going to interrupt real quick. If your camera is on and you are not a ASL interpreter, if you can please turn your camera off. I think it's pulling from the bandwidth, and so we're losing some of Dr. Miles here. So if you can please turn your camera off. If you are not an ASL interpreter or the person currently speaking, that would be greatly appreciated. And then, Dr. Miles, if you're able to go back just a couple minutes, I hate to make you say start over, but I think we started losing you a couple minutes ago, and people were unable to get to continue hearing you at that point.
Okay, I'll try my best to summarize. My main point is that African American disabilities benefit less from disability policy, and from the ADA. We still haven't, received the promise of full inclusion that is included in the ADA to the same degree as other Americans, white Americans with disabilities. And not saying that white American disabilities don't still have, barriers, but that African Americans have the added barrier of race, and we have to contend with racism and ableism. So we experience disability within a racialized context that put us in a further disadvantage. And so, we're more likely to be in poverty, more likely to be unemployed, etc. And also that the COVID-19, the high rates of COVID-19 are the result of social and economic inequalities that are an outcome of racism and not an outcome of cultural pathology within the Black community. So when we have less access to insurance, and we're more likely to be in dangerous jobs, we're more likely to be frontline workers. All those issues put us at greater risk for acquiring COVID-19, just like they put us at greater risk for having disabilities. And then once we do have disabilities, we have less access to resources to help rehabilitate the disabilities, to help accommodate the disabilities that we do have. And so those are some of the comments that I made, and that I wanted for us to really think about what we can do to mitigate the racial implications of having a disability. Is a constant question that Black people with disabilities have to manage, that we experience services from a white majority space where our doctors are more likely to be white, our healthcare providers, our teachers, we're more likely to receive services from people who are not a part of our culture. And so they may have implicit biases that further put Black people with disabilities at a disadvantage. And so we need to further invest in deinstitutionalization of our nursing homes. We need to further invest in home and community-based services, and all of our disability policy needs to think about the racial implications and not assume that we all benefit from disability policy in the same way, or that we all have access to the same resources, because for African Americans, that is not the case. And these issues are also gendered, and so African American women with disabilities have high rates of disability and of severe disability, and then they're more likely to receive lower wages than men with disabilities. So then they benefit less from Social Security, disability insurance, because they have lower wages. They're more likely to be single parents, so then they have lower wages, but then they have higher economic dependence and higher economic need. And so all of these things can be changed through policy and legislation. And so I think what's really frustrating about the outbreak of COVID-19, the high rates of COVID-19 in the Black community, is that it was predictable, and it could have been addressed from the beginning by sending in a surge of funding and resources to the communities that were most vulnerable. And that didn't happen, and we have to ask why. And so in closing, we need to think about how both the Black community is a community that has to assert that their lives matter and that it's valued, but also the disability community has to assert that our lives matter and that we are valued. And so in very systematic ways, we have to think about rationing care and challenge the idea that somehow, because we're disabled, our lives are less worthy of being saved. And so anyway, these are some of the issues that I wanted to address, and I wanted to thank you all for your time.
Thank you so much, Dr. Miles. I apologize for losing Dr. Miles a little bit there in the middle, but that was a really strong ending. And I hope if you are an aide or you're here from a congressional office, I just really, it was so important when Dr. Miles pointed out that when we look at policy, not everybody has, often it's written as if everybody has access to the same stuff, which isn't the reality of the country we live in. So I really appreciate Dr. Miles bringing out that point. Next, we are going to hear from Anita Cameron.
And so my name's Anita Cameron. I am the Director of Minority Outreach at Not Dead Yet. My pronouns are she, her, hers. I am a Black woman with long locks. And I am wearing a Black shirt with multicolored writing that says, "I love my Blackness and yours." So there, that's kind of my introduction. So the thing that I wanted to talk about was, as I said, I'm Director of Minority Outreach for Not Dead Yet. Not Dead Yet is a national disability rights organization that is opposed to assisted suicide, doctor-assisted suicide, and euthanasia of people with disabilities. And I had begun to do some highlighting of racial disparities in healthcare that leave communities of color vulnerable to assisted suicide as it occurs. And in the states where assisted suicide is legal, we're seeing an incremental rise in the numbers of Blacks and people of color who are requesting assisted suicide. It's incremental, but it's there, and it's dangerous because the disparities in healthcare that we have push us into into risk of being convinced that we should choose assisted suicide. So people think about that and like, so what does that have to do with COVID-19? Well, in this age of COVID-19 and people doing more and more telemedicine, so the organizations out pushing for assisted suicide are taking this opportunity in Massachusetts and a couple of other states to rush through that legislation. And so they're kind of doing it sneakily, if you ask me. So with assisted suicide, people with disabilities, seniors, sick people, disabled communities of color are more vulnerable because of our poverty rates, are the inclination in society to devalue the lives of people with disabilities. And although proponents say, we want to be able to choose when we die, pain and all the reasons, the top 5 reasons that are given for assisted suicide are disability issues. Feelings of being a burden, loss of independence, the losing the ability to do activities of daily living, incontinence, feelings of being a burden to their families. Pain or the fear of it isn't even in the top 5. It's like the 7th reason for that. And because of the mistakes that you make about determining of what's terminal and all, that's another addition, on to why it's dangerous, because we don't know these things. The doctors make mistakes all the time. So one of the things that makes assisted suicide dangerous is that hidden in it is expanded definition of what terminal is. And the expanded definition goes out to include disabilities like diabetes, chronic illnesses, because the law says that if you cannot get access to healthcare, you can then request assisted suicide. And that's, I've seen, to say the least, that because you can't get the healthcare you need, because you lose healthcare due to insurance and all, that puts you, at a certain level of despair, and you say, okay, I'm not going to live. Give me, let me do this. And so that puts people into danger. So then when we have disasters, what happens? We're folks with disabilities and we die needlessly. We die unnecessarily. because of our disabilities, because we don't have the access, to things, because we're sitting up now in nursing facilities and other institutions, including prisons and jails and detention centers that are run rapid with COVID-19. And who's more likely to be in those situations? Black and brown people. Who's more likely to be caregivers in those situations, attendants? Black and brown people. In disasters, who's more likely to die? Folks with disabilities in Black and brown communities. So my thought is that one of the given and take into account the disadvantages that we face, one of the things that we need to do is to be more involved in the process of disaster preparedness, emergency preparedness. We need to be involved in that on the ground.
Anita, I think you may have muted yourself.
This is how you serve us. And let us serve our communities by serving on these boards. Let us serve our communities by being community emergency response team members. Let us serve our communities by, serving on committees so that we can show you how we deal with our communities as people with disabilities and as Black and brown communities. Because right now, the disaster field, if you will, it's still white and male dominated. And we need to take a look at that because, as was said earlier, as we're receiving, care and services, it's more likely to be from people who aren't in our community. Same happens with disasters. And we need to be able to have folks be involved in disaster preparedness before, during, and after disasters so that we, can, when possible, if we have the resources and all, be able to serve our communities and help our communities and show you, how our communities, how we need to be served and how we need to, to be, how we need to take care of each other and look out for each other in our communities and all. And so that's kind of where I'm ending. I'll just summarize by saying that we are, as Blacks, as people with disabilities, we are at a disadvantage, but we can. There is that hope that we can get more involved in helping our communities, in serving our communities, and in doing so, making sure that our communities are served in disasters, because otherwise we die unnecessarily, and that needs to stop, especially in this age that we're dealing with police brutality and all of these things, horrors that are happening against our communities. Perhaps we then need to be out there more and insist to these agencies, whether it's FEMA, Red Cross, local, state, national agencies, to insist that we are there and that we are listened to, because they say that when you're not at the table, you're on the menu. If you're not careful, you can be at the table and still be on the menu. And so thank you for allowing me, to speak on this. And I thank you. This is an honor, and happy Juneteenth, everyone.
Thank you so much, Anita. I think I will, put that on a shirt. If you're not careful, you can be at the table and still be on the menu, because I think a lot of us have definitely felt that. Let's go ahead and we're going to have our last panelist come up. If you have questions, you can put that in the chat or send those to info@disasterstrategies.org. And hopefully we'll have some time for some questions. And so we're going to open it up to our last speaker, Tyree Brown.
My name is Tyree Brown, and I am an artist. I couldn't get this set up for a long time. I'm an artist, and I am currently 25 years old right now. But I'll do this. So, in 2015, I was in a car accident, injured. I was injured in a car accident, and I became quadriplegic. Soon after, I was in rehab, getting help in order to gain function with my arms and my legs. But months after, we realized that my home wasn't accessible, so I had to go to a nursing home. Being in the nursing home for a few months, then having to go back to rehab, and then only to later find out that I had to go back into the nursing home was frustrating. I remember being in rehab that they said, if you're in the nursing home for 30 days, there is a program called the Medicaid Waiver Program, and then it'll be a program where you can go home. But I was in the nursing home for more than 30 days, and that whole thought of me going home just passed me by. The hope of me... I'm in a conference. Oh. Yes. Sorry for that. I was in the nursing home and just never knew I could go home because my home wasn't accessible. I then months later went by and realizing, okay, I'm just here, but someone from the Money Follows the Person program came. His name was Mike Saunders, and he asked me, do you want to go home and get out of this nursing home? And I said, absolutely, what do I need to do? He gave me some papers, helped me fill it out. Turns out it was the same program that I heard about, that Medicaid program that says you can go home if you're in a nursing home. So I filled out the application, and there was a counselor who came to me, then a supports planner who worked out things. Okay, do you need a rent? Do you have somewhere to go home? I knew I had my parents' home to go to, so I gave them that address, and they sent me all of the information, what I need. I needed an aide to go home because during that time I couldn't function. I couldn't put my clothes on. I could barely do anything for myself. And so the program was able to find a budget for me to so I can have an aide, so I can have disposable equipment and all the things that I needed to get in order to go home and live in my community. A few months later, they were able to build a ramp and give me a stair lift, open the doors in my home, so they can be wider for my wheelchair to go in, and give me just other equipment that I needed in order to be home. Because I am an artist, it was very difficult to have my own space being in the nursing home. I really couldn't do anything. Now that I'm home, I'm able to create my artwork. Individuals come to me and they say, hey, I need you to draw this for me, and I draw it for them. So far, right now, I'm working on a project for a family member that wants me to draw something, the biggest drawing that I've done after my injury. Being home, I was able to go to outpatient rehab where I learned how to dress myself, getting out of the bed, go to the bathroom by myself, all things that I was not able to do or know how to do if I were to be in the nursing home. And like it was said before, lots of people, it's like more than half of the COVID-19 deaths come from people in the nursing home. And I just think it could have been trapped in the nursing home or just being sick because I'm in a confined space. Being in the nursing home at 20 years old during that time, it just was not the move for me. And I'm so grateful that God gave me this opportunity to come and tell you all that it's best to be home. And for any program, I just know that we need funding for that Money Follows the Person program, because it helped me to get home. If I didn't have Mike Sanders, the counselor, come in and give me an application to fill out saying this is a program that will get you home, I'd probably still be in the nursing home because I did not know how to get out. And it's a blessing that I'm home and making art and being in my community, going to outpatient rehab. I graduated from college with my associates. I had art shows along the way. It's really nice being out of the nursing home and being in my community thanks to these programs that are out there, but lots of people in the nursing homes unfortunately don't know about them. And I'm finished with what I have to say.
Thank you so much, Tyree. Excuse me. And I want to just highlight, especially for those that are doing policy that are part of this virtual session, that program has still not been made permanent. We did get an extension on it, but it has still not been made a permanent program. And we really have a preconceived idea about who it is that is in nursing homes, whether or not they want to be there and why. And so I really appreciate Tyree sharing that story and kind of helping to break some of those preconceived ideas about the functioning level of people in nursing homes, the age and what people look like in nursing homes, right? And that it's easy or not to get out when it's really not. So if you are on the Hill, I know a big cry from the disability community is permanent authorization of money follows the person. So we're going to go ahead and do a couple questions. We have about 10 minutes left. So if you do have questions, you can put that in the chat, or you can go ahead and send an email to info@disasterstrategies.org. So we're going to start with one. Sorry, I'm juggling a couple of things here. On the note of COVID and the Black community and kind of this intersection that we're seeing here with the nursing homes with money follows the person, do any of our panelists want to maybe take on a conversation about specifically, like we've talked about, we're seeing over I think the last estimate we saw was about 55% of COVID deaths are taking place in nursing homes. What can we talk a little bit about what it looks like to provide support for something like a pandemic within the Black community or Black and Brown communities? I think all of our panelists touched a little bit on the need to include these communities in the emergency preparedness work that we're doing. What does that look like for the COVID pandemic? Does anybody want to go ahead and try to answer that? And we can have Dustin turn on your camera.
The one thing we need to realize is that we're still living the legacy of slavery, and so the wealth gap, the Black-white wealth gap in America is still big, and so a lot of people will say, well, why are we talking about slavery? That was a long time ago. That has nothing to do with me. It happened before I was born. But wealth is accumulated from generation to generation, and so African Americans did not, were left behind, while white Americans have like a 400-year head start on wealth accumulation. So one thing is that Black communities are less likely to have the resources, to support people getting, out of nursing home and living in their communities and living at home, and so Black communities may need, more funding, more housing supports, so that someone can move out of the nursing home and into affordable housing that is accessible. And so that's one issue that is needed, that may be different for the Black community than the majority community. And so we may need more economic support than other communities. And it's, I think that it's still ongoing, but it is possible for us to deinstitutionalize our society more and really change the way we look at providing care for people with disabilities. and we need to fund PAs so that they also receive benefits and that they receive a livable wage, because you can't care for someone else if you can't care for yourself. And so oftentimes PAs don't even have health care themselves, and then they get sick, and then they can't take care of people with disabilities. And so it's a domino effect. But we can solve these problems if we decide that that disabled lives are valuable, that Black lives are valuable, that aging folks' lives are valuable. We can solve those problems through our policies. And so I'm hopeful that things will get better. But we have to make a decision and decide what country, who we are, who we want to be.
Thank you for that. That was a great answer. I love you can't take care of someone else if you can't take care of yourself first. And I know a lot of us have been long fighting for our home health aides to have benefits, better pay, better reimbursement, because they are doing a lot of work to make sure that we can live within our communities and be part of our communities and aren't compensated as such often. So we have another question here. If one of our panelists want to jump in, it says, how can community leaders do more in their neighborhoods while protecting from COVID transmission from your perspective? What are most leaders missing? Do you have anybody that wants to jump in there?
This is Anita. I will try. Can you repeat that question, please?
Yeah, it's how can community leaders do more in their neighborhoods while protecting from COVID transmission from your perspective? And what are most leaders missing?
So this, Anita, I think that we have to watch out for our neighbors as best we can. I think that we need to, when possible, and this includes people with disabilities, as well, that we kind of do informal visits, for lack of better words, cruising patrol, visiting our neighbors informally before disasters and all, so that we can make sure that everything's okay. One of the things that I've heard here during COVID is that oftentimes some of the mutual aids are unavailable to us in the Black communities, or poor, or we disabled can't always get, the things needed, so that if we, if we're able to, and we've got masks, on, that if we can go and kind of socially distancing safely check on our neighbors. We don't have to be cert or have any certification or whatnot to do that, to say, hey, are you okay? Do you need food? Do you need diapers? That we have to, because from what I'm hearing a lot of times, these services and mutual aids and whatnot are not available to us, that if we can start, ourselves, that if we've got, a couple of extra ramen noodles and, an extra roll of toilet paper, or extra, this, that we, go and we offer it, to our neighbors, that we get up with, if we know of community organizations in our neighborhoods, get in contact with them and make sure that they are also serving people with disabilities in our communities, making sure that we're doing this. A lot of the things that we can do, can be done very, informally, we don't have to have special certifications or special skills or, a degree or anything like that. It's just a matter of caring about your community and you being able to physically, do the thing that you can to help your neighbors. I think that as we are helping, each other, that brings our communities together. And we just have to make sure that the community is including us as folks with disabilities, especially, in the Black communities, that we speak up, that we say, hey, our wanting to be involved as people with disabilities isn't taking away from anything. We're here. We're here. We're disabled and Black, and we want to help our communities as well. Yeah.
Thank you very much. This is Valerie again. I think we are right at 12 o'clock. So it looks like we did have some additional questions that were coming in, but I think we're right at 12 o'clock and are going to have to wrap up here, but we will be sending out a transcript, a recording, through disasterstrategies.org. So if you received this because you are on our listserv, you'll receive that. But if not, and you are interested in getting this or sharing this, give us a little bit of time and we will get that up at disasterstrategies.org, where you'll be able to have our transcript and the recording so you can take some of the things that we talked about today. This was wonderful. Thank you so much, Anita, Tyree, Dr. Miles, Justice. You guys provided so much to think about that is necessary. Thank you again. To everybody on the ground who's helped, and to Congressman Casey and Langevin to help us put this together. We really hope that you were able to take something that you can take back to your organizations, to your congressional offices, so that we can start looking at bringing in Black communities into our disaster preparedness, so that we can make a more equitable response. Thank you so much, everybody.